Today we're going to talk about how to properly get checked for cervical cancer. Hi, I'm Ashley. I am a fourth year medical student who's 2 months away from graduating and becoming a doctor or a physician. And my goal is to empower people with these videos to improve their health literacy or health education. So when they go in for their doctor's appointments, they know how to advocate for themselves and their health. So on social media just a few weeks ago, there was a popular influencer, Jessica Pettway, who posted about her journey with cervical cancer. I think it was in late stages when it was finally discovered, who ultimately passed away. And the story was very moving because she described having multiple hospitalizations with increased bleeding and other symptoms, trying to figure out what was going on. And it sounded like it took a few months before she got to a diagnosis. I wanted to speak more on this subject and kind of inform others out there about the proper way to ensure you're getting properly checked for cervical cancer when you're going to your doctor's office, and also ways that you can potentially prevent cervical cancer. Let's get into the video. Firstly, cervical cancer is caused by a virus, human papilloma virus to be specific. There are multiple strains of this virus, but there are specific strains that are more likely to lead to cervical cancer. Anyone who has sex is at risk of acquiring the human papilloma virus, but there are some strains that will ultimately lead to cervical cancer. Those who are at risk of getting HPV that could potentially lead into cervical cancer is anyone who engages in sexual intercourse. It can cause cervical cancer. It also can cause anal cancer and other forms of cancer. So men, women, and people at the youngest age that can take the vaccine to the oldest age take it, since this medication is out there to prevent the transformation. How is cervical cancer detected? For those who were assigned the female sex at birth, these usually include going to an OBGYN, having a pelvic exam that leads to what most people call a pap smear. But the pap smear involves them using a kind of tool, I'll flash on the screen, that they enter into the vaginal canal to open it so they can view the cervix, which is at the back of the vagina. And then in this process, they have kind of a bristle brush looking tool, a collection kind of container that has fluid. And with this bristle brush tool, they're able to stick that into the cervical canal and grab some cells, and they'll stick it in the collection container. And they also have this thing that kind of looks like a mini broom is the best way that I can describe it. I'll try to put it on the screen. And they'll also use that to take samples of the outside of the cervix, which is ultimately collecting cells from the cervix. This collection container, they'll send those cells off to the lab. And in the lab, they'll analyze if those cells are common for what they see on the cervix, or changes in these cells, indicating that these cells may dysplasia or metaplasia, which indicates that these cells are changing their specific type, which is a common feature of precancer or cancerous cells. And that is usually what is taken away from a pap smear. Every person who goes to get a pap smear may not have to do them on the same basis as another person. So it is very key when you go in to talk with your OBGYN or family practitioner to ask, based on your other medical conditions and other risk factors, how often should you be getting. So let's talk about results. When getting a pap smear, there are 3 buckets that your results can fall into. 1 would be normal. The cells on the cervix look expected. They mirror what typical cervical cells are. You're fine, you're good. Come back at your next pap smear. The second one is abnormal precancerous cells. And precancer meaning there are changes to these cells. It's not confirmed cancer, but the physicians are concerned that without treatment, these cells could potentially develop into cancer if nothing is done about them. And third is a confirmed, this is cervical cancer here that we're seeing, And we also are going to do treatment and figure out how far this is within the body. So after an abnormal pap smear, so if you fall into bucket 2 or 3, your physician is going to want to ensure that the lab results from that little sample bucket are correct. So they may ask you to opt in to getting a procedure called a colposcopy along with an endocervical curettage. So both really big words. The colposcopy ultimately is like getting a pelvic exam where they use like a squirt of fluid, which helps them visualize the cervix and certain abnormal spots better. And they're able to take a physical sample off of the cervix. That is usually the colposcopy. And then the endocervical curettage, again, is they will stick something like a bristle brush or something deeper into the cervical canal, because the cervix kind of looks like a donut, to make sure they get the cells on the inside, to make sure they can check those better as well. And they will also send those cells off to the lab. The colposcopy and endocervical curettage will yield results letting the physician know how far out these abnormal cells go, if they are only in the cervix or if they have release from the cervix, and a few more details about what those cells are like. So treatment, if you fall into abnormal bucket 2 or 3, is usually with procedures called a LEEP or a cone or a cold knife conization procedure. Both of these procedures are excisional, or meaning that they will cut the impacted areas of the cervix out to prevent further spread of the abnormal cells. Finally, if you are one to have either of these treatment procedures, such the LEEP or the cone, you will be subjected to coming back to get pap smears on a more frequent basis than someone who has had normal findings, just to ensure that the doctor can follow up with you to ensure no reoccurrence of abnormal cells has happened, and to ensure that if there is cervical cancer, it has not developed anywhere else. So all in all, early detection is better if you can help it. So try to follow up with your physicians about ensuring you're on your accurate pap smear schedule and following up if there are abnormal cells detected. As well, if you don't have a Gardasil or an HPV vaccine already, ask your primary care physician or your OBGYN about getting one. I'm pretty sure they extended the age limit out to 40. I can double check that and correct it on the screen if I'm wrong. I know at a point in time it used to be 20, but they're widening that window. Early detection is good, but prevention is best if you can help it. So that's all for today. I'm glad to be your medical advocate. Until next time, talk to you later, guys. Bye.